Hello, and welcome to Thematic Intelligence. At Global Data Thematic Intelligence, we track over 100 tech, industry, ESG, and macro themes impacting all major sectors. I'm Aisha, and today I will be talking to Tamen Jadad-Garcia, a commercial and healthcare communications strategist. Tamen is the co-author of Healthy No Matter What, a Penguin Random House title that has been featured in Time, McKinsey, and Fortune. I had the pleasure of knowing Tamen in high school and always saw her as a role model, and I'm delighted to welcome her to the Global Data Podcast. Tamen, how are you?
Hey, it's great to see you. Super happy to be here and excited for our chat.
Amazing. Thank you so much for doing this. I'm so excited to share your insights with the Global Data audience. So let's jump right into it. You authored a book called Healthy No Matter What alongside your father, Dr. Alex Dad, who is a physician and entrepreneur. And your book proposes a holistic approach to health. How do you think health tech companies can use this method when they're designing their products and services?
Yeah, great question. The main crux of what we present in the book is a new perspective on health, one that views it as the ability to adapt to life challenges rather than a state of complete physical and mental well-being. So in the book, we show how the most effective offerings are those that focus on either or both of the following approaches to help people adapt. So the first is either focusing on curing the curable, and the second is on managing the manageable. And that does sound kind of obvious, but when you really lean into it and you align with it, you're able to have a bigger impact on the ability of your patients and your users to adapt. So let me give a couple examples. 1 in 6 deaths are caused by cancer, and experts are turning to new digital tech and health innovations to fight against it. In the case of curing the curable as a means to help patients and users adapt, N1X10, an organization offering personalized oncology advocacy, is a great example of this. They connect patients to a global network of cancer professionals powered by proprietary digital technologies and methodologies to offer precision medicine, personalized treatments, and manage all the data involved in navigating the cancer journey, ultimately bringing the best health tech together to help cure the curable. In the case of managing the manageable as a means to help your patients or users adapt, the focus here is on dealing with challenges that are essentially unfixable, such as chronic diseases or non-communicable diseases, which affect 45% of American adults. And this can include diabetes, heart disease, respiratory disease, arthritis, amongst others. And an example of health tech that follow this kind of approach are the various apps and devices that help those with diabetes reverse and prevent type 2 diabetes. And what's super exciting is the FDA just authorized the marketing of a VR system for pain relief. So there are ample opportunities for health tech companies to better serve and reach their patients or customers when they have this kind of clarity and lean into their strategy of either curing the curable or managing the manageable and help their beneficiaries enhance their ability to adapt.
Amazing. I think that approach is very much rooted in extensive research that your father and yourself conducted, as is the new approach that you guys have just debuted on task automation called computational management. Could you talk us through this approach and how it incorporates AI?
Yeah, absolutely. We're super excited about this. With AI developments booming, we keep hearing leaders within organizations asking, how do we integrate AI into our existing workflows? So, in an effort to help manage the expectations and mitigate the frustrations that come with this, we published precisely the article that you mentioned that introduces computational management. So, formally, computational management and technically is a systematic approach to task automation for enhancing the ability of organizations to harness AI's potential within existing workflows. But essentially, computational management offers a series of steps to help you break down complex operations into manageable tasks and gives you clarity relating to when and where to implement AI. Computational management is structured around 3 overarching steps that help leaders start to implement AI. So the first one is called task reformulation. And in this step, work processes are broken down into their most basic tasks that AI can efficiently and effectively execute. So each would be characterized by a singular, well-defined action leading to a clear outcome and can be completed by a single person or AI agent. For example, prepare marketing materials for product launch is not a task because a single person or agent couldn't do that, prepare all of the marketing material. However, draft the website content for the new product is. It meets all of those criteria. The second step is focused on task automation evaluation. So in this step, the basic tasks that you kind of break down in the first step are evaluated and ranked based on their automation potential using what we call the task automation index. And this is a super easy to use tool, which helps to assess the criteria of a task, such as standardized input, clear rules, repetitiveness, data dependency, and measurable outcomes to pinpoint the most automation-ready tasks. And the third and final step is centered around filling out a task specification template. So this template consists of 16 components, and the idea here is to complete that template for these tasks, and that will help you get clear language so that you can identify and adapt AI solutions and start to integrate them into your existing workflows. In the article, we offer both manual and automated methods with prompts ready to just be copied and pasted into publicly available LLMs to complete these 3 procedures. And it's really, we've focused on making it as easy and straightforward so you can start your AI integration journey.
Amazing. And apart from its usefulness, what I find really inspiring about computational management in you and your father's view is that it takes a very optimistic kind of view of AI and how it can enhance workspaces. What are your hopes for the future of AI and how can we best embrace it?
Absolutely. There is so much potential if we mobilize the power of AI. And my hope is that we can avoid another AI winter and that we can prevent frustration amongst organizational leaders and unleash a new level of performance as professionals, seeing AI as a superpower rather than a threat. And to do this, we need to get better at identifying when, where, and why to apply AI. So to prevent this frustration and achieve better results. And that's kind of why we created computational management and tools like the Task Automation Index to show which ones are easier and more amenable to be completed by AI or a person. We also need to align AI solutions with organizational needs and find synergies where humans and AI can work together, where they can complement each other's strengths and free us from tedious and wasteful tasks, and allowing us to harness the power of what really makes us special. We also need to have a common language, is what we've found to be able to materialize these hopes between AI developers and users so that we can create the most effective tools and they can be easier to adopt and to help match the settings for which they're designed. And then we also, I think, to be able to materialize on these hopes and the potential of AI, we need to be excited about these new possibilities. If we do this, we can leverage AI's power to access insights and generate data analysis that are previously unimaginable, making us more informed, efficient, and capable in our roles, leading us into the future and showing us a way to tap into new and exciting sources of value.
That takes a very hopeful view of the future, which leads me nicely on to the final question. What are the key health trends you can predict for this year and going forward?
I'm really excited about how patients will start to get empowered with multimodal medical large language models. So these are capable of processing text, image, audio, and video and trained on validated and up-to-date health information. With these, patients will be able to take more control of their care, be more engaged and aware of their situation, and contribute to finding better solutions that meet their needs. So they'll be able to be true partners in their care if that's what they want. I'm also excited by how AI will help us optimize clinical trials, speeding up the time in which pharmaceuticals are tested and brought to market so that they can be offered to people who most need them as soon as possible. And finally, I'm really excited about how AI will be used this year to help identify new druggable targets for diseases that would have taken massive teams and years to identify.
Amazing. Again, that takes kind of very optimistic view of how we can integrate AI into health. And I think it's definitely not something we should be afraid of, but something we can embrace as a society. Thank you so much for being here, Tamen, and thank you so much for your insights. They've been so valuable, and I'm so excited to have you on this podcast.
Yeah, it was a pleasure to be here. Thanks for the opportunity.
And thank you for listening. And from us in Thematic Intelligence, see you next time.